mission of the San Francisco Department of Public Health is to promote the best possible state of physical and mental health for all San Franciscans. Over the past 2 decades, San Francisco's population has grown by nearly 7%. We are a community of racial and ethnic diversity. The combination of economic stress, increased density in housing and living conditions, the increased number of homeless persons, upsetting poverty rates, decreased state and federal support for health-related services, and major transitions in the regulatory and healthcare environment make the provision of client-centered, community-oriented, and culturally competent healthcare a significant challenge. Let's hear how our San Francisco Department of Public Health is responding to these challenges and moving us into the next millennium.
It's a real pleasure to serve as the Director of Public Health in San Francisco. It is a fascinating time in the industry of healthcare, and really a fascinating time in terms of the revolution and evolution in healthcare in the United States. There are a number of challenges that the Department of Public Health faces over the coming years, and I'd like to be able to outline some of them to you. I think, though, that the most important message I'd like to start off with is that in San Francisco, we're able to have a state-of-the-art health department, largely because of the community participation the department enjoys, the constituency, and the general level of interest that San Franciscans have in the health and well-being of its residents. We think we have one of the finest health departments in the country, and we hope to be able to highlight for you today a number of the areas into which we think we are really at the cutting edge of responding to healthcare crises, anticipating healthcare crises, and be able to forge meaningful planning, meaningful policy, and leadership with other stakeholders and other providers in the city to promote the best possible well-being for all of the citizens in San Francisco. One of the major emphases of the Department of Public Health in approaching the millennium is to take all of our personal health services throughout the department and integrate them from the point of view of information services, medical services, and clinical programs so that we have a single entity providing those services, and we do it in the most cost-effective way possible. We have 3 very important principles about how to design services. One is that those services need to be culturally competent. San Francisco is a very diverse city. We have many different language needs, very different cultural needs, multi-generations of first generation, second generation, other generation Americans. And so cultural competence and how people use healthcare services is a very, very important component and principle behind the design of any current services or new services. We believe services should be community-based, that we should draw on the assets and the strengths of community to provide services, and that above all our services be driven by consumer needs, that they be consumer friendly, that they be consumer oriented, and that we not design them from an abstract policy perspective, but we design them on an informed basis from the people who will be needing them and using them over the future.
Laguna Honda is a very interesting facility. There's no other place like it in the whole country. We are the largest municipally operated long-term care facility in the country with a total of 1,202 skilled nursing beds. And we have a small hospital which gives us the distinction of a generic term being called a distinct part nursing facility, distinct part to a hospital. San Francisco's population, I believe, ensures that we will always have a need for a facility like Laguna Honda, perhaps not as large as this one. I think it's a misconception by many folks that you have to be poor and destitute to get into Laguna Honda. That's not true. What you have to be is a San Francisco citizen. I think it's the best quality care that one can get for long-term care. If I had a loved one or a friend, regardless of how much money I had, I would recommend, given what I know about Laguna Honda, that they would come here.
I'm happy to be part of Laguna Honda as a head nurse and as a professional licensed nurse. I'm proud to be a part of the team here at Laguna Honda. She's the youngest resident at Laguna Honda since I got her in 90. So now she's in high school. She's going to Louis Lombard High School, and this year will be her last year because she's 21-year-old already.
I think that animal therapy is a really important part of activity therapy department, just because it seems like the patients get a lot out of their interactions with the animals. Sweet Pea the pig really makes people light up when she comes into the hospital, and just the reactions are just like, ah, a pig.
You missed one.
But on the way back, she's like a barn horse.
There you go.
She knows she's going back, and
I think you know what that means.
she moves right along.
And she turns heads, that's for sure. The farm here is I really think, is a sanctuary for everyone that either works here or who lives here. The patients come out here to find some peace and serenity, and so do the staff. A lot of times people come out here and eat their lunch, and it just gives them a place where they can come.
And instead of having a person who comes in from the community, particularly for the AIDS community, where most of the people we get now are homeless and are living in shelters or on the streets, you see a person that's dying in a place of community and love and caring. You see them dying in a place where people really care about what happens to them. So I'm most proud of our environment, and I think it kicks into something very primal in all of us, that we need community.
It's like our home and our family here. For example, when we made this beautiful garden, which made by volunteer mainly, and some of us, including our doctor in the hospice, coming at Sunday, Saturday, still he's coming. So this is my ritual place. Every morning when I come in, I just pour the water in. I put 3 fresh flowers in to our patient, their family, and the hospice staff. So we try to keep this unit really as homey as possible.
This is a birthday card that the hospice community created for itself. It took several weeks, and everyone in the community participated: the patients, the families, the staff, the volunteers. This reflects what we're trying to accomplish here, which is to create a therapeutic community. And we're looking at various ways to bring people together. Creative activities and art is one way that we can bring people together. We also use food, cooking activities, meals and celebrations to bring people together. And of course, personal relationships, which are really the hallmark of hospice care.
Public hospitals across the nation are headed for some challenging times. Over the past decade, public institutions have been recognized for their unique services and have been provided reimbursement in support of those services, such things as disproportionate share financing out of the Medicaid program. As the industry begins to change and as Congress takes on the issues of healthcare reform, the root of these funds are beginning to be challenged. This presents a major dilemma for public institutions across our nations, especially in California, where we have a number of public facilities that are in crisis. We at San Francisco General have taken on the challenges. San Francisco General has a budget of over $250 million and employs approximately 3,000 people. The whole campus, which includes the university and our research, increases that employee count to about 6,500. This is a tremendous economic force in our community. We estimate that yearly San Francisco General pours back into the city about $220 million in economic stimulus. This is in the form of jobs, this is in the form of purchasing power. We work closely with our communities, so many of our contracts are actually let with local providers and minority firms. This helps us to be a good neighbor, and again, it stimulates the economic development within our city.
My name is Officer Robert Richards. I've been with the police department for a little less than a year. I'm one of the newer officers. I quickly came to realize how much time police officers do spend here at San Francisco General, both with suspects and victims, and sometimes each other. It's a great hospital. The staff does a great job, and it's a pleasure to use this hospital.
Hi, I'm Officer Echebeste. I've been in about 7 years. It is well known in the department that if you were ever shot, that we want to be sent here because the trauma here is excellent. And I explained to him that if I get shot, I want to come here.
The emergency department really is in many ways, at least my observation, is sort of the entrance into the system for a lot of people. And we try and make that as smooth as possible. It isn't always 100% just due to the nature of emergency departments, but I think we run a darn good place here. What we do for this city and to be able to participate in it is probably one of the pleasures of the job, as well as just the excitement of the environment. Where you're pulling on your multilingual skills, your cultural skills, as well as your scientific skills in dealing with immediate crises and emergencies that occur to people. Everywhere from the actual laying on of hands and what we do to notification of family members who are either at home or have to come in or are here already and interacting with the families. Again, it's a very rich experience. But we take care of every conceivable type of incident that happens in the city, all kinds of people. It's probably one of the most, if I was a writer looking for material, I couldn't look for a broader perspective of types of human beings to come in contact with. San Francisco is like that anyway, and a place like this is sort of the crossroads of San Francisco in many respects.
I enjoy working in the emergency department because it's the interface between the hospital and the healthcare system and the community in many instances. And it gives me a chance to be the first doctor to meet a sick person and to try to help make them better. I also like working here because this hospital prides itself and is very good at giving culturally competent care to sick people regardless of their financial status or their insurance status or their immigration status.
I enjoy working at San Francisco General Hospital because of the diversity of our patients and that we are culturally competent. We have doctors that speak multiple languages here and that the house staff is excellent, the nurses are excellent, and the extra workers that we have here, the social workers and all of the nursing assistants are just wonderful.
I'm very committed to this hospital. I think that this is one of the best public hospitals in the United States. And it's clear that if we are to continue doing the outstanding work that we do in both the public ways, which is trauma and AIDS, and quite frankly, in the not-so-public ways, which is in the kind of primary care we deliver in the primary care clinics here. We're going to have to be creative, but we're also going to have to rely on the support of the citizens of San Francisco, the citizens of California, and quite frankly, hopefully, some changes at the federal level. One of the things I'm most proud of at working at San Francisco General, particularly in the Family Health Center, is the cultural competence and the cultural diversity that we have here. The Family Health Center includes the Refugee Medical Clinic, and combining the Refugee Clinic with Family Health Center, there are over 15 languages represented by the patients who are cared for at this health center, and 11 of those languages are represented in the staff who work here. We're diverse, we're proud of it, we're able to serve just about anybody who walks in the door with any kind of problem and of any age. And that's the kind of work that's done at SFGH.
Show me, lift up your shirt for me. Okay, good. Point to your heart. Where does your heart live? That's good, that's good. Now listen over here because that's where your heart is, okay? Good. Is that cold? Yeah? You want to listen? Put in your ears. Listen to your heart. What do you hear? Burr. Ah, it's burr, huh? You're silly. It's not a burr in there, is it? Yeah. Yeah? Yeah, let me listen to the back. How old are you?
4.
Are you 4? Okay. You know what we have to do today? We're going to do some lab tests on you, and then we're going to do some shots for school.
Why?
Well, because they'll make you nice and healthy, and that means school can take you. Dr. Wolf, can I have his chart, and I'll just take him over to the immunization place? Yeah, let's go talk to Sam.
Yeah.
I have a DTaP number 5, an MMR2, and a PPD.
How you doing, man? Good.
See? No needles. My name is Sam Hill. I'm one of the nurses here at San Francisco General Hospital's Pediatric Center. Some of the things we do here in our shot room are give the kids their immunizations, either shots or through the mouth. The most important thing is that they get these immunizations on time. I've been working here for 5 years now. I enjoy it very, very much. It's a very, very fun job. I mean, working with kids is the funnest thing you can do is being a nurse. I love it.
One of the things that we're very proud of in the Department of Public Health is the quality of the services that we give. At San Francisco General, our AIDS clinic here on Ward 86 is one of the, in fact, it's the nation's top AIDS program in the country. Our hospital services and our outpatient services. It's a good example of the kind of quality work we provide in the health department and quality care to all of our patients. We also are very proud of the fact that physicians and any other licensed personnel that work for the department actually see patients. And as Director of Health, one of the more enjoyable part of my job is continuing to see continuity patients at San Francisco General's AIDS Clinic, where I've been seeing patients since essentially 1988. We continue to stay on the cutting edge of the AIDS epidemic, and even as this epidemic changes, we're committed to good facility support, good clinical support, and compassionate, high-quality care.
When I came to Tom Waddell Clinic, I had a sense that the dedication and the commitment of the people that work here was unlike any other place I had worked at previously. We work in a very particular fashion in that we have a multidisciplinary approach that includes social workers, mental health workers, outreach workers, physicians, nurse practitioners, and nurses, as well as other health workers. The needs of people that are on the street, and the longer they are on the street, comprise a whole set of needs that include social services, mental health needs, substance abuse counseling and programs. I feel that in this program, I am allowed to preserve the integrity of the patient-doctor relationship. In addition, the people that I work with have such a commitment to preserve the dignity of the people that we serve. And I have never seen this in any other institution. This is really a very special place. Our population is very varied. We have excellent mental health workers and people that will go the extra mile to provide the services to our clients. I have watched over the years how some people that were, one would say, almost lost in that they were extremely disorganized mentally, unable to comply with anything, with problems of substance abuse, paranoia, all sorts of difficulties. And I've seen people like that actually turn around and be able to have productive lives. And I think that that is directly as a result of the kind of services that we provide. I'm very proud to be a member of Tom Waddell Clinic and Homeless Programs of San Francisco because I can provide the kind of quality medical care that I have always dreamed of.
I came about 25 years ago was the first time I came when it was just, you know, a little first aid station. One doctor on, I prefer Tom Waddell. It's just a more home type feeling that you get that they're really looking out at you.
One of the important aspects of our facility is its location. Silver Avenue Family Health Center and the Southeast Health Center are the only two medical facilities south of Cesar Chavez Boulevard. Because of our locations, our facilities become a vital part of medical care in the San Francisco community. our main emphasis is taking care of people. Our staff is very dedicated. They've been working with this community for many, many years. They look forward to and really enjoy their work. And through that, I enjoy my work even more.
Restaurant inspections are the core of public health activity. Mostly I inspect restaurants, food establishments, grocery stores, bars. The bulk of my work deals with food protection. I also go in and inspect laundromats, tattoo parlors. I've done massage parlors before, pet stores, pet hospitals, and general problems in my district. It's really important because a lot of the places that I go into, the operators are just not educated as to how to do things in a sanitary way. They may be knowledgeable in the way of cleanliness. They may keep a clean facility. However, it's a sanitation that we need to concentrate on. It's a sanitation that affects people and affects the quality of the food and whether or not somebody's going to get sick if they eat there. I wouldn't trade my job for anything. It's great. I love it.
And in today's world, health is a very big issue for young people, not perhaps in the traditional way that people think about health. But our children are growing up in communities surrounded by violence, and violence has been recognized as an epidemic and as a public health issue. Since public health has to do with the health and well-being of the community as a whole, San Francisco's Department of Public Health reaches out into the community to find different ways of addressing the needs of young people. Adolescence is a time in which young people are struggling to find out who they are, what their purpose is, where they can go, what they can do with their lives, and how to do it. And it's also a time in which they're trying to do that without too much help from adults. And yet, in today's world, the kinds of situations that they face are life-threatening. The challenge for the Department of Public Health is to continue to find ways to provide relevant services. YPEP is a way that the Department of Public Health has found to bring young people into the direct service arena so that they can reach out to other young people.
We educate them about sexually transmitted diseases, reproductive health, AIDS, HIV, safer sex, self-esteem, how to make right decisions, talk about drugs and alcohol, and basically any other issue that is affecting the youth of today. And being the first prevention education program using peer educators out of the health department, we have been very successful, and it's really important to have these type of programs there. We're the front line on this war. People tend to forget about us, but we're the ones out there doing the education.
Yep, that's the real
We're the
deal.
ones out there in the projects, in the jails for the youth,
Yep.
telling them, you know, trying to keep them safe.
And trying to mix it up with some of the gang people to tell them that this is what they need to do to keep themselves safe and they can do right by themselves.
Our Division of Mental Health has some very important goals that we have for our division. And they come out to be cultural competency, consumer guidedness, and community-based services. And it's in these three areas that we try to deliver our services to the San Francisco community. Under managed care, an area that we hope to be moving into is the design and development of mental health promotion and much more prevention services to serve San Francisco community in a way that is much more broad-based, where public health, substance abuse, mental health, social services, all of our different departments can attempt to do some effort together that can bring about a better San Francisco community, and for us particularly in the mental health and mental well-being of our people in San Francisco.
A lot of my job is really fiscal quality assurance,
And in the course of doing my job, I live to do one thing, and that is to make the triple play. To come in on budget, to make sure that our clients have the level of service that they need, and also to save the taxpayers money. There's nothing greater than being able to see people get what they need and to get better. And my colleagues, in terms of the course of doing this, show tremendous creativity.
Our work here at Target Cities is pretty unique in that we actually engage clients through a variety of mechanisms. We have developed a lot of systems integration approaches, working very collaboratively with the criminal justice systems through the drug court in the court system, and adult probation, the public defender's office, the district attorney's office. We also have a collaborative agreement with individuals out at San Francisco General Hospital to see clients out in the hospital's campus. And we have collaborative agreements with individuals in the mental health system as well as Department of Social Services. So we both focus on interagency collaborations within the department as well as other city and county government agencies. Substance abuse services throughout the city that the department funds is a relatively young field, and the professionals that work in that field are very skilled at being flexible and recognizing changing times, assessing the variety of needs that individuals have and referring them to the most appropriate treatment. And we are very fortunate within the substance abuse system that we have a continuum of care that ranges from detoxification from drugs and alcohol through residential day treatment, outpatient care, and into aftercare services to assist a person while they're reintegrating into their community again.
I am tremendously excited about the challenges facing the department and our ability to meet these challenges. I think the department really is going full forward with trying to create a service delivery system which meets the needs of its diverse population and which meets the complex psychosocial and healthcare needs. And I can say assuredly that our department will meet these challenges.
As the director of the Department of Public Health, I'm extremely proud of the services that we provide in San Francisco, both to the community at large as well as to individual people who rely on us for health services. It promises to be a very exciting future in the delivery of healthcare services, and we continue to look forward to working with our local community agencies and consumers in a partnership that will help San Franciscans realize the healthiest possible state of physical health, mental health, and economic vitality possible in San Francisco.